Happy New Year. I'm Jodi Mitchell, Senior Director of Government Relations and Policy at the Center for Health Affairs and CHAMPS GPO, and I'm bringing you the first Policy Points update for the new year. 2025 marks a new administration, congressional session, and state general assembly. While all of these changes in Washington and Columbus can appear to add chaos and disruption in the policymaking process, a new start can also be an opportunity for innovation and new ideas to be infused in legislation. Just prior to the holiday season, Congress took action on an end-of-the-year package to temporarily extend DSH payments, ensure funding for community health centers, and provide an extension to telehealth waivers, as well as continuing the Hospital at Home program. These extenders were short-term, however, expiring in the spring. Therefore, we must continue to seek sustained funding to ensure access to care. What didn't get done and remains critical for our healthcare system: physician payment fix, PBM reforms, workforce protections. As we begin the 119th Congress, we will remain vigilant to oppose site-neutral payment policies, protect 340B drug program, monitor proposed changes to Medicaid, and also reductions to CDC funding. All of these are potential pay-fors for the administration as they pursue a budget reconciliation package currently under consideration. In Ohio, we saw several bills passed and enacted that will require continued engagement as they are being implemented. Legislation was enacted regarding hospital violence protection and training and security planning that supports our dedicated healthcare workforce. It sends a message that workplace violence will not be tolerated. Price transparency was amended into legislation that was passed and enacted that codifies price information requirements for hospitals must follow. We will be monitoring the implementation and burden on providers and seek to support compliance. In the next legislative sessions, under new leadership and new committees of jurisdiction, the Center for Health Affairs priorities include ensuring access to care and stability of the regional healthcare system, with a focus on funding, efficiency, regulatory burden, coverage, and access and outcomes. We need to ensure Medicaid is fully funded and continue Medicaid expansion and coverage subsidies. We will reject payment cuts that jeopardize access to care, such as the 340B program and site neutral. We will continue to support federal funding provisions, DSH, telehealth, rural access. The second priority is addressing healthcare workforce needs. We will focus on policies related to safety and workforce shortages. We will continue to build support for the SAVE Act to protect our healthcare workforce. As we enter into a budget year in Ohio, the Center is working with statewide partners on a proposal to create a statewide infrastructure to support Ohio health workforce excellence. This is being done in collaboration with hospitals, providers, academic and training programs, and workforce development organizations. Our third priority is advancing quality, equity, and innovation. We want to support efforts to safeguard patient safety and protect data from cyber threats. Through our SDOH Innovation Hub, we will support data-driven approaches to address social determinants of health to improve overall health outcomes. And we are going to promote initiatives that support a more integrated and cohesive healthcare system. We seek to bridge gaps to ensure equitable care across all aspects of healthcare delivery. The Center's agenda places emphasis on improving healthcare accessibility, retaining and recruiting a stable healthcare workforce, advancing innovations in care, and addressing social inequalities within our healthcare system. These actions can help ensure a more effective, sustainable, and inclusive healthcare system for the region. We look forward to partnering with hospitals, providers, and the community to improve the health and well-being in Northeast Ohio.